Salam-e-Jahan.
अस्सलाम वालेकुम नाजरीन, मैं नुशी महमूद
और मैं परवेज़ महमूद।
आप देख रहे हैं हमारा प्रोग्राम सलाम-ए-जहां।
नाजरीन, जैसा आप जानते हैं, सलाम-ए-जहां वीकली प्रोग्राम न्यूयॉर्क से आपके लिए पेश किया जाता है। ये प्रोग्राम आप जादू बॉक्स के चैनल 1593 और हमारी वेबसाइट raham.tv और फेसबुक पर भी देख सकते हैं। ख़वातीन व हज़रात, हमारे आज के प्रोग्राम का टॉपिक इंतहाई दिलचस्प और बहुत इम्पोर्टेंट है।
हम आपके लिए 3 खास हेल्थ केयर एक्सपर्ट्स इनवाइट कर रहे हैं आज के शो के लिए। आइए हम आपको उनसे मिलवाते हैं। हमारी पहली मेहमान है सारा अहमद इमादी, जो है हेल्थ एजुकेटर।
अस्सलाम
वालेकुम सलाम। हमारी दूसरी मेहमान है डॉक्टर सारा अमीन, जो है डॉक्टर ऑफ फार्मेसी।
अस्सलाम
वालेकुम सलाम। और हमारे तीसरे मेहमान है डॉक्टर मोहम्मद उमर।
अस्सलाम वालेकुम।
वालेकुम अस्सलाम। नुशी, दिस इज सच अ कोइंसिडेंस कि हमारे इस सोफे के ऊपर 2 साराएं बैठी हैं एक साथ हैं। ऐसा कम होता है कि दोनों ख़वातीन बैठी हैं, दोनों का नाम सारा है।
So should we call you, refer to you as Dr. Amin or Dr. Sara?
डॉक्टर अमीन ठीक है।
डॉक्टर अमीन, ठीक है, चलिए, वेरी गुड।
And also, by the way, Dr. Amin and Dr. Omar are husband and wife.
Wow, you know,
माशाल्लाह।
माशाल्लाह, this is so great that इन्होंने आज हमारा हेल्थ केयर का टॉपिक है और इस हेल्थ केयर में इन दोनों ने अपने घर में सारा मामला जो है बिल्कुल ठीक कर दिया। तो
चलिए, Sara, just tell us about yourself. Introduce yourself to our viewers.
Sure. I was born and raised in New York. Currently, I'm living in New Jersey with my husband and my 2 kids. I studied my bachelor's degree at Hofstra University and my master's degree at Lehman College, which is City University of New York.
Chalo, good, mashallah. Or Dr. Amin?
I was also born and raised in New York. I'm a hospital pharmacist, and I went to St. John's University to complete my Doctor of Pharmacy degree. And now I'm here on Long Island.
Chalo, good, mashallah.
awesome.
So Dr. Umar?
I grew up in Pakistan. I came here as a small child. I lived in New York my whole life. I went to undergraduate school at NYU.
Okay.
Then I completed my medical school as well as my residency in New York, and I did my spine fellowship in Massachusetts, and now I'm back here in New York.
Chalo, good.
Very good. डॉक्टर उमर, ये बताइए कि when was the time in your life that you decided that you want to be a doctor?
That's a great question. I really decided late in high school, early in college, what I really wanted to do. I felt a strong urge to want to help people, and I also had a good background in science. I found that it came easier to me to manage, and so I pursued that course of career.
So आपने बहुत छोटी सी उम्र में you made a decision that you want to be a doctor and you want to help others.
Yes.
Great, very good.
Sara, tell us about you. How and when did you decide you wanted to be a health educator?
I've known for a very long time that I've wanted to be a teacher, but when I was in grade 10 is when I decided that I wanted to teach health and did my research on which colleges have programs for that, and that's why I ended up choosing Hofstra. And
So you actually decided all this in grade 10?
yes,
You were really young at that time.
yeah, 15.
Wow. Okay. So at age 15, you also wanted to go into kind of a program where you would help others.
Yes, I had a very good relationship with my health teacher, and she was very close to a lot of the students in the school and made a big difference for a lot of people, and
Yeah.
I wanted to be able to do the same.
Okay. Very
हम देखो माशाल्लाह how effective teachers can be
of
to
course,
students.
इन्फ्लुएंस करते हैं। टीचर्स का इन्फ्लुएंस बहुत पॉजिटिव
Yeah.
होता है स्टूडेंट्स के ऊपर, और उसी की वजह से स्टूडेंट्स जो हैं, यहाँ तो टीचर्स की वजह से प्रेसिडेंट ऑफ द कंट्री बन जाते हैं
Yeah.
स्टूडेंट्स, you know. So that's how it goes. How about you, Dr. Amin?
So my father is a pharmacist, so I was exposed to this my whole life. He's in the retail setting. But growing up, I had asthma. So when I was a child, I had something called a nebulizer, which was a big machine where you'd put the medicine in this little thing, and then it would be on a mask. That you'd sit there for 15 minutes to get the medication. Now, my dad, as a pharmacist, recommended at a certain age that the doctor change me to something called an inhaler, which is You guys are probably familiar. It's like a little device where you can get the medication.
Yeah.
So that was a huge change. It changed my quality of life, and it really helped me as a child, and I wanted to do the same for other people.
Oh, mashallah.
This
Very
is such
nice.
inspiring. These are the stories that we want our viewers to relate to. So many of you actually thinking about going into various careers, and you do have stories like this, like these three have. And we want you to achieve your goals also in life. ये बताइए सारा कि आप एक्चुअली क्या करती हैं?
My certification from my bachelor's is for teaching health in a school setting, so I'm certified to teach K through 12. My experience is with grades 6 through 12 primarily. And my master's degree is to be able to teach health in a community setting, so at a clinic or with different kinds of public health agencies, etc.
The question was that, rather than asking you what grades have you taught, I just asked you a question that what actually you do. This was my question. What do you do really, So
I start with my bachelor's degree, right?
Right.
Yeah.
Okay. My bachelor's degree allows me to teach health in a school setting, so I'm certified to teach grades K through 12. My experience is primarily with grades 6 through 12, and my master's degree allows me to teach health in a community setting, so I can work with any type of health agency or clinic, etc.
So you do teach in school and you go out in community centers also?
Yes, primarily my experience has been in the school setting.
In the school setting, okay. And you said you teach from grade what to what?
6 through 12.
6.
So actually I started teaching right after completing my bachelor's degree, so I was 22 years old and I had some students who were 18 years old already.
Wow.
So yeah, it was quite the experience.
So health education is a pretty broad subject.
Yes.
So what exactly is health education when you're teaching, high school, let's say?
Okay, I don't teach in a gym. I'm not a physical education teacher. I teach health, which is in a classroom setting, and really everything can be divided into being either physical health, social health, or mental and emotional health. And we focus on how our behaviors and our decisions and our choices can really impact the quality of our life and the quality of all those different types of health. And we work on skill building and preparing students for the real world.
So social health is what? I know emotional health can be, your mental state. Physical health is obviously, your body. But what is social health?
For example, something like bullying or peer pressure, which is unfortunately a really big problem, especially in the middle school, grades 6, 7, and 8. And, we discuss how even though that's part of social health, how it ends up affecting your mental and emotional health, the stress that can come from that. And then physical responses also that can happen, for example, changes in sleep, changes in eating, etc.
Wow.
So do you get a lot of children that come to you after class and ask for advice or support?
Because of the topics that I discuss in my class, I do have a lot of students that feel comfortable coming to me and discussing problems or concerns for a friend. And depending on what it is, there are some things that can be handled between the two of us, and oftentimes I end up having to reach out to a guidance counselor, maybe a school social worker, could be a student's assistance counselor in the school, and somebody who's trained to specifically deal with some of those situations at a greater.
Wow, this is becoming more interesting than what I thought.
It's a very complicated.
It's a complicated thing, but you have mentioned many things. I'm going to come back to you with some of the things that I heard. Let me go to Dr. Umar. Dr. Umar, you said that you started thinking about becoming a doctor at your young age also. What kind of doctor are you?
I'm a specialist in interventional spine. I treat mainly non-surgical spine disorders, including back pain, neck pain, and chronic pain.
Okay, so we have back pain, neck pain. I think
Make an appointment. We'll squeeze you in.
let me say this. हमने अब तक ये सुना था कि ये इंटर्निस्ट हैं, ये हार्ट स्पेशलिस्ट हैं, ये कैंसर के डॉक्टर हैं.
हाँ, this is very rare.
So this is you said spine. What?
Correct. So my specialty is interventional spine. I treat, again, non-surgical spine disorders.
So you discourage your patients from having surgery? Is that what you said?
No, I treat them conservatively before surgery so we can avoid surgery.
Okay, they can avoid.
So I treat patients usually prescribing physical therapy or pain medications, anti-inflammatories, or even spinal injections, including epidural injections and such.
So you said pain medication, meaning that you make sure that people do not have pain.
Well, I always tell people it's pain management, not pain disappearing.
Right. Okay.
So I can't make their pain go away, but I want to make them at least manage their pain so they can have better quality of life and better activities of daily living.
Okay. I think I heard you saying earlier that you are not an MD but you are a DO.
Correct.
What is the difference?
There is no difference clinically in the real world in terms of practicing.
Right.
Basically, I went to an osteopathic medical school. We learned the same thing as MDs, but we also learned some osteopathic manipulation to treat certain disorders and conditions with our hands.
Yeah.
But I treat the same as MDs. I'm able to prescribe medications. I'm able to perform procedures just the same as any MD. There's no difference realistically.
This is very interesting.
Let me say this to you. It is interesting, but the words that he's using, I am sorry, I won't be able to repeat those words. This is all technical lingo for me.
I know it, and it's very new subject for us.
Yeah, it is.
Very interesting
and I'm sure that our viewers are looking at Dr. Umar, and some of you are definitely understanding what he's saying. I'm trying to understand him also, but I think by the end of the show I'll know exactly what he's saying. Let's come to Dr. Amin. Dr. Amin, you are
Doctor of Pharmacy.
Doctor of Pharmacy. Okay. We've heard pharmacist, but we have not heard so many of Doctor of Pharmacy. What does that mean?
So basically, we have a couple extra years of training, and now I think, especially in New York State, we're trying to gear towards the Doctor of Pharmacy degree. I know many schools offer solely that degree, and the emphasis is placed more on clinical work because now, so much information is readily available on the computer, through our computer systems. So then we try to focus on something more clinical things. For example, in the retail setting, now pharmacists can give vaccines and injections, whereas before they couldn't. So it's a constantly evolving profession, and they're constantly, broadening the aspect of what we can do as pharmacists.
I see.
When we went for Umrah, we had to get the shot, and I got it at the CVS.
Pharmacy unit.
It's easier for patients. It's easier.
But still hurting.
She can prescribe you medication for that.
Pharmacy is something which is, pharmacists are I don't know if they get due respect or not in this world. But I think that pharmacists play a tremendously important role because they actually give you the medication that the doctors prescribe. God forbid if they make an error, things can go totally the other side. Oh. Is it not true?
That's so true. Especially in the hospital setting, people underestimate what pharmacists can do because we're involved in indirect patient care. You won't see us if we're in the main pharmacy, but we constantly get questions and constantly, especially the physicians or, mid-level practitioners, they'll ask us, we have this medication, how do we dose it? How frequently do we dose it?
So it's the doctors that come and ask you these questions.
Right.
So you advise doctors too?
Correct.
Yeah. Wow.
Very interesting.
I give this doctor a lot of advice.
Yeah, yes.
And I hope he takes it.
I do, yes I do.
खवातीन हज़रात, ब्रेक का वक्त हुआ चाहता है. छोटी सी ब्रेक के बाद आपकी खिदमत में हाजिर होते हैं.
We'll be right back.
Salam-e-Jahan.